PCOD is basically a metabolic disorder. This is Dr. Sheetal Agarwal. I am a senior consultant associated with Zyla Health. What exactly is PCOD or polycystic ovarian disease? Very commonly in my OPD, every third or fourth patient comes to me complaining of polycystic ovarian disease. Now, what exactly is this polycystic ovarian disease? So, why this polycystic ovarian disease is so common, why it has become so rampant these days? Here I would like to say that it is a lifestyle disorder. More common in the urban areas where we have a hectic lifestyle, there is no work-life balance, it is a very stressful life, our eating habits are very erratic, our sleep patterns are very irregular, and all this precipitates polycystic ovarian disease. So, what exactly does patient come to me when she complains of PCOD? Her first and main and foremost symptom is irregular periods. By irregular periods, I mean that her periods come every 2 to 3 months. The flow could be heavy or less and they last for 1 week to 10 days. This is the main symptom, but many a times patient may not have irregular period and she may come to us for the treatment of infertility that she is not getting pregnant, and on investigation we come to know that she is suffering from polycystic ovarian disease. So, second common symptom of PCOD is infertility. Apart from these two main symptoms, patient can have acne, she can have sudden burst of acne on her face, she can have pigmentation of the skin, particularly at the nape of the neck, at the axilla, or at the undersurface of the breast, which is typically called acanthosis nigricans. Patient can also present to us with hirsutism. By hirsutism, I mean that she can have undesirable hair growth at the upper lip, on the chin, on the chest, her arms and legs, at the back. This undesirable hair growth is known as hirsutism, and patient can present only with hirsutism also at times and may have regular periods along with hirsutism. Patient can present to us with obesity also. Normally we see that PCOD patients are generally obese, but that does not mean that lean and thin patient cannot have PCOD. If a lean patient has PCOD, we call it as lean PCOD. So, these are some of the common symptoms of PCOD. And why it manifests? PCOD is basically a metabolic disorder. So, what happens is that during this PCOD, the hormones level becomes upheaval, they become upside topsy-turvy in the female body. The male hormones level like testosterone levels rise up, and the female hormone, the active form of female hormone estrogen, which is in the form of estradiol, its level goes down, and inactive form of estrogen, that is estrone level, increases. So, this topsy-turvy of the female hormones and the male hormones in the female can cause metabolic disturbance. At the same time, there occurs insulin resistance in the body. By insulin resistance, I mean that insulin is the hormone which is secreted by pancreas and which helps in the metabolism of the sugar. Now, once there occurs insulin resistance, the sugar which is present in the body is not metabolized by the insulin and insulin levels start increasing. This can lead to eventually formation of diabetes in the female. So, there is a metabolic disturbance, and this metabolic disturbance can lead to the onset of various symptoms. At the same time, in PCOD, one important thing which I would like to mention is that ovaries, they form the follicles, but these follicles are not released in our body. So, these follicles form small cysts, small tiny cysts in the ovaries, giving it the appearance of polycystic ovaries, hence the name polycystic ovarian disease. And how do these cysts appear? These cysts appears like at the periphery of the ovaries in a pearl shape, in a pearl necklace shape appearance, giving it a appearance of pearl string appearance. So, this is how we see it on the radiological diagnosis. Multiple cysts are present at the periphery of the ovary and the ovarian capsule becomes very thick. All these symptoms and all these manifestations leads to the formation of PCOD.